Greetings. Number 2. So why is this crazy lady doing a podcast just hours after she's been told she has months to live? Because she's brave? I don't know about that. Because you need to see, you nurses, you students, you junior doctors, whoever this is going out to. You need to see this at the most raw. You need to hear what it is to be me, the patient, at the most raw, at the most delicate. Because sometimes patients are given bad news in hospital. The curtain's drawn around the bed and the doctor gives the bad news. Then they walk out of the curtain, leaving the patient on their own, having been told they only have a few months to live. Some patients are left in the hospital bed without a single soul to console them, because the nurses are herring around like blue chickens, trying to nurse the ward. The carers are running around trying to do their job, running around, carrying and answering buzzers. And there's a patient in the corner with the curtains pulled around the bed, and they're too weak, too scared, too much in shock to pull the curtains back round or to press the buzzer. Because if they press the buzzer, it's going to be a long time before anyone answers, because everyone's so busy. The mobile phone is the other side of the bed. They can't reach it, or it's run out of juice. And that patient's on their own. That can't happen. It's happening every day. I went to a workshop run by the Patient Association, and that was one of the things that came out, was that so many patients are given bad news and left on their own. I'm sitting here in my living room. I have my son, my husband, and a dear, dear friend here to support me. I'm supported by so many people outside of this room. But right now, I have people here who will hold me and who will support me and who will love me. And I have people here who will love and support my loved ones as well. Yet there is a patient in a bed right now, I can guarantee it, who's just been given the news that I've been given. And that cannot continue to happen. There needs to be something put in place when a patient is given that bad news, that a nurse is there, ready to sit with that patient as soon as that news is broken, who can pass them their phone, who can be there. Because you're hearing me talking as raw as I possibly can, hours after being told my news. I'm frightened. I'm angry. I'm very weak. I'm extremely tired. But I'm loved. And I'm supported. And if anything that can come out of this tragic circumstance is if one of you nurses one of you doctors, one of you students can capture something of what I'm trying to do with these podcasts and can reach your full potential and can nurse to the standard of the nurses that I have been nursed by, if that makes sense. The nurses on C4. If you can develop your intuitive skills, if you can look with the eyes of your heart and not just the eyes of in your head, if you can look with the eyes, if you can make that understanding, that connection with the patient, not just through what you read in your books and you hear from other people, other lecturers in your lecture theatres. I'm not taking anything away from the lectures, I'm not taking anything away from your study books, because you desperately need to know all the things, and you do attend lectures. Don't skip them. But if you can understand something, capture something of what I'm trying to tell you, look at your patient, understand your patient. There'll be one more recording. One last one from tonight. Coming up.